Hello, my name is Dr. Carl Amodio, and I'd like to take a moment here to introduce and talk about a technique that I do in my practice called Neuro-Emotional Technique. I am an applied kinesiologist, chiropractor, board-certified diplomate in applied kinesiology, and I'm also on faculty at Life University here in the Atlanta area. And one of the techniques that I've recently incorporated in a very large way is called Neuro-Emotional Technique. And to give you an example of this, if somebody comes into my office with a complaint, a physical complaint, typical traditional medical model is to look to that area of complaint. So if somebody comes in with shoulder pain, they're going to have an area of shoulder discomfort that a medical doctor may give a prescription for or recommend exercises or things of that nature. But as a holistic doctor and applied kinesiologist, one of the things that we really like to look for is the underlying causes of these conditions. And what I find that, for example, if somebody comes in with a shoulder issue, is I have to see if that's coming from an emotional issue or a physical issue or maybe a chemical or nutritional imbalance. And the real interesting thing is with the emotions, because somebody could have an emotional restriction that's actually causing shoulder pain. And this is something that a lot of people do not necessarily consider when they have shoulder pain. So somebody, for example, could be holding on to anger or resentment, and that would translate into excruciating shoulder pain. This would not be picked up normally by a traditional medical doctor. So it's really exciting to be able to discover different ways to see how everything is connected to everything. And using this technique, this neuro-emotional technique, we're able to find the restrictions in the body, and then we're able to release them very quickly, very effectively, non-invasively, no drugs, and all natural.
I have actually suffered with 2 brain surgeries. I've had to learn how to walk again. I've had to relearn absolutely everything. Every learning disability you can put on a child, I had. ADHD, dyslexia, they never could understand why I couldn't learn. My last brain surgery was at 19 years old, a year after I aged out of the foster care system. Aging out of the foster care system is one of the hardest things I've ever done because you're on your own. I always call it aged out is being timed out. Your time is out. So now today I travel across the country, sharing my heart, sharing my life as a trauma coach, teaching people how to persevere. 2 years ago was one of the most hardest traumatized experiences that I went through. I saw my abuser for the very first time, and it brought back a lot of emotions. Basically, at night when I would fall asleep, I would have severe nightmares. I was being terrorized, literally. I was in the critical care unit at my local hospital on heart monitors, heart medicine. They couldn't figure out why my heart was beating 200 beats a minute at nighttime. Every moment, it felt like I was reliving it all over again. And I met a friend of mine, and she had shared with me about Dr. Carl. She was like, just give it a shot. And I'm like, I've been in counseling for over a year through talk therapy. I've traveled around the country. I've worked with some of the best counselors. I don't know what to do. I'm at my wit's end. And she connected me with him. And ever since that day, I'm totally recovered from this, where I felt safe and I felt secure in his office. And most importantly, from that point on, my nightmares just was blurry and then slowly faded away. Once I went to him, now I'm free from that. I'm no longer on heart medicine. I'm no longer on beta blockers. I'm totally free. I have so much energy. I feel alive. I feel passionate.
So I'm asked from time to time, how exactly does this neuro-emotional technique work? And I like to explain it like this. Basically, your brain is like a computer, and your body holds on to emotions that you've experienced in your life in these files. And we go through our lives, our subconscious mind remembers everything we've ever experienced from the time we were conceived until the present. It remembers every color of every shirt of every person we've ever seen in our entire life. But what happens is sometimes if we have a negative emotion or a traumatic emotion, It gets stored in a file, and that's like a computer file. And then down the road, you may have a triggering event, a smell, a sound, an action, or the way somebody says something that triggers that particular file to open. And when that file opens, you experience everything that you've experienced at that time that you had that emotion happen to you. And if it was a stressful situation, that causes stress in your body, and that physical stress is actually real. So what we're able to do is we're able to delete the file and reboot your computer.